I can be emotional with food, but what's my balance? We have people who have metabolic syndromes, junk food, ultra-processed food, diabetes, and only when they realize, like, I've decided I don't want to live like this anymore, so they decide to start changing their nutrition. But the point is,
welcome to another podcast episode, Gut Feeling with Dr. Pal. In this podcast, I have a wonderful guest. He was my inspiration while I was doing the weight loss journey. I followed his videos and adopted so many good techniques.
the longest living people are not nutraceutical junkies. They eat in moderation. They're not exercise junkies. They're happy people, great relationships. They have humor in their life. They know how to be grateful for what they have. Okay, everything is simple. Now, when you have data points showing you this, why does the other part of the world ignore this? Because there's business. I need to push a longevity nutraceutical. I need to push a way of diet because I can make it into a business tomorrow.
What is manifestation and how should we use it?
I think, the world has made manifestation a kind of an airy-fairy subject where people don't believe. But this clinical depression is very, very different from the way people go around labeling themselves as depressed.
But you cannot win social media.
Exactly. So what we need to do is realize what is the time in life that we expose them to social media. I can't say social media is a bad thing. It is always the person who's using it. Like, I can't say...
Hi, Luke.
Hi, doctor. Pleasure to meet you.
Pleasure
Good to see
meeting
you.
So good to see you. I can't believe that I'm talking to you in person. The same person I've been seeing in the videos 2-3 years ago. Sleep well, meditate well. You're doing a wonderful job.
Oh, thank you.
Thank you so much. So the main reason that I really like your job is that you are one of the pioneers in India where you have integrated lifestyle medicine with actual medical treatment as well. And this integrated lifestyle medicine is the talk of the town back in US from where I practice. Every street, they have opened up the lifestyle clinic. And I strongly believe that it has to be combined together for the better outcome of the patient. Can you tell us what is integrated lifestyle medicine for my audience?
Right. Thanks for having me, doctor. We get inspired by your shows.
Oh, thank you.
I love that you have medicine and humor and all of the tips that you share with everyone. So fantastic. A lot of our patients enjoy your shows as well.
Thank you.
So thank you for making medicine light and
Lighter.
happy as well. So, no, it's great you talk about integrative and lifestyle medicine. So about 13 years ago, I got introduced to it when I was in the US. Yeah, I learned of that subject. I was still trying to find my path. I'm a nutritionist basically, and I didn't want to just do nutrition. So I had a really good mentor at Yale. And once he understood, what I wanted to do, he said, this is a subject. This is lifestyle medicine is a subject. And he said, this is what your country needs because you'll have personal trainers, you'll have chefs, you'll have cooks, you'll have everything, but the gap is lifestyle. So I came back to India and I said, let me look around and understand what's going wrong. And it was exactly that. People had knowledge. The internet was blowing up at that point. We were still on Blackberries, although, BBM and all of that stuff, but there was information. But I saw the gap was lifestyle, even though people had everything. And I figured this is the line. And when I dive deeper into this subject, it made absolute sense. See, we have great medicine, you have great nutrition, you have great research, you have scientists, you have everything around, but it's fragmented. The patient is a whole. We can't just look at the heart without looking at other parts of the body. We can't look at the liver without looking at chronic stress levels, without looking at emotional wellness, without looking at nutrients, nutrition. So everything is very symptomatic based in medicine, which is not a problem. That's how medicine works. It's designed to, treat a symptom and it can save lives. But what about addressing the root cause? So what if a patient is on a steroid or on a chemotherapy or on a diabetic drug? Fine, please, let the doctor do their job, take the medicine. But what about the root cause in the first place? Why do you have diabetes?
Correct.
Why do you potentially have a cancer? If I address the root cause, while the chemotherapy works, the radiation to break down your symptoms, how do we prevent a reoccurrence? For that, we can only address the root cause because there is no medicine that can prevent reoccurrences. It comes down to lifestyle. So I think that little bit of detective work kind of fascinated me, that how do we get to the root cause of the problem? So integrative medicine is, number one, looking at the patient as a whole Bio-individuality. That means respecting the fact that every person is different. That's why no one drug will have the same medical outcome on all the patients. It will be different.
Correct.
Nor will the same food, nor will the same exercise or the hours of sleep, because everyone is different. So first is bio-individuality, getting people to respect their uniqueness. What works for you doesn't have to work for someone else. Then looking at the changing nature of disease. Disease is also changing. We saw that with the whole virus,
Right.
how it could become something big and then slowly phase out and die down. We see that with environment changing and impacting the way pathogens, germs, or even cancers are expressing themselves. Basically coming down to your genes. How are they upregulating and downregulating with the impact of environment, external and also internal.
Right.
My own, if I'm constantly stressed, my genes are behaving very differently when I'm happy and when I'm in balance. So you look at that. Then the root cause, like, why do I have this condition? What is it that I need to change along with my medicine? Take your medicine. But the beauty is, if I also change my lifestyle, your own doctor is going to look at your symptoms getting better and slowly reduce your medicine, come down to the lowest possible dosage, or even get you off, once you've addressed the root cause of the problem. So integrative and lifestyle medicine looks at these 4 pillars, which is cellular nutrition, not Google nutrition, but cellular, according to your cells,
Not
your
the cellular.
mitochondria, your inflammatory levels, your CRP markers, because it's really about absorption of nutrients, synergistically working in your cells. So you have cellular nutrition. Then you have movement and exercise. What suits your body type? Not what the whole world is doing. Everyone responds. Your genes respond differently. Your absorption rate in your gut. So your exercise and movement. Third is your sleep. And fourth is your emotional wellness. And the fifth is your spirit. When I say your spirit, we're not talking about religion. We're talking about how connected are you with yourself.
Self-love.
Because that brings homeostasis in you. But when we're constantly outside searching, the immune system is erratic, there's always disharmony. So how do we bring these 5 pillars together for a patient? Let medicine do its job. It's not a fight against medicine. Of course, sometimes there's a fight because sometimes you're unnecessarily put onto a drug, and you're not told that if you change your lifestyle, you can get off. So there's always those things. And there's always the fight also with certain nutritionists that, hey, food can't solve every problem. Sometimes you need the drug.
Right.
You need both of them to work together.
Right.
So integrative medicine kind of breaks that gap. It's really about, we care for the patient. Okay, whatever works for the patient that doesn't cause harm, how do we put that together? How do we bring it together for the patient?
So I strongly believe in this because, in our medical literature, we don't talk about it that much. We talked about the secondary prevention. Correct? The primary prevention is what that you are trying to get at. And when there is a disease, I strongly believe it has to be combined together. It's a marriage between medicine and also the supportive treatments. Among all the things that you talked about, you see so many patients, right? You see cancer patients, you see patients with diabetes, blood pressure, everything. I know you have some inspiring stories, right? You always talk about. Can you share with us a patient that inspired you based on the interventions that you did?
So I think, we have inspiring patients every single day, and that's what gives us strength.
Satisfaction.
And strength. Like the other day, I had a 24-year-old girl just come out of hospital, and she got onto a Zoom call immediately because she was getting her diagnosis and her prognosis completed. And she had a 2nd stage triple negative breast cancer. But she was like very calm talking to me, and so we're trained to identify something called low anger scores, where you put on a front like you're strong, nothing's happening, but inside, it's bottling up, and that's actually worse for you. It's better to be emotional about it and then, come to acceptance. And I asked her, we went through everything, understood what the doctors want to do. She understood what we're going to do, and then I asked her, I said, you're really calm. And you know what she said? She just said, Luke, it's a little bit of a shock, but, my God has gotten me through so many things in life. This is another thing that's come my way. He's going to get me through this as well. And the way she said it with faith and belief, right then, you have that gut instinct. I knew she's going to be fine.
Wow.
She's going to be fine. Just that attitude, that mental strength, it creates an energy for her as well as you.
Wow.
And right then, and it's amazing how a journey's been.
Wow.
These kind of patients, their chemotherapy works better on them in terms of they don't go through that many side
seen
effects.
That, huh?
The acceptance. They're in acceptance. See, I always believe if the human mind rejects something, the body rejects it. So a lot of people, I hate medicine. I'm afraid of medicine. And when they have to take it, for whatever, because they have to take it. It really doesn't work efficiently to someone, okay, I'm wary about medicine. If I don't need to take it, I won't take it. But if I need to take it, I'll go. I'm taking it with trust and faith. I mean, we all know the placebo effect is real. Pharmaceuticals use that as a benchmark for their drugs to come out into the market. So if it is real, how do we get it into our practices?
Wow.
And then we've seen simple things. We've seen patients who have complicated issues and they've come on our plans and stuff. And when you're looking at everything, you find out, okay, this person is so sleep deprived. And sometimes we start getting them, to honor their sleep, and you won't believe it. They don't need nutrition. It was only the sleep that they needed. Something as small as sleep can literally bring correction in their body. Now, I don't mean to say sleep and don't take medicines and everything's going to be fine. You get my point. It's inspiring when you see how these small, powerful things like sleep just brings the body back into balance and they start to feel better. The same thing with food. We have people who have metabolic syndromes. Junk
Diabetes,
food, ultra-processed food, diabetes. And only when they realize, like, I've decided I don't want to live like this anymore. So they decide to start changing their nutrition. And we put them on simple, basic stuff. Within a week, just changing from junk to natural food, they feel their energy levels come up, blood sugar drops. So these are like inspiring moments to show you that it's possible with even the smallest change. Someone who's sedentary, they just start walking for 20 minutes a day. A week later, they look, what's next? I need to work out more. I feel so great. My muscle pain's disappearing. So I think the inspiring part is, and then we see miracles all the time.
Right.
We see miracles where medicine doesn't work anymore, like a 4th stage cancer, palliative care. And then this patient is like, hey, Luke, I'm just going to pray and I want other people to pray. They join prayer groups where people just pray for them, group energy. And you see miracles which I know science can't explain,
sometimes
medicine can't explain, life can't explain. But that inspires us to believe that there is a higher power. Some people call it God, some people call it the universe. But the beauty is there is something, and sometimes it humbles us. That like when I look at, like I always ask people, whatever you've achieved in life right now, is it everything that you've done alone? They say, no. Then who's done that? Who's helped you so far? And then we start realizing, we need to use all these energies. I mean, medicine's great, nutrition is great, but it's not everything. It's not everything. Everything is when you put all these things together. So these are inspiring stories. I mean, cancer patients, I know it's a stigma. And see, there is destiny. I'm not here to say that everyone will live if you do all of these things. I mean, if my destiny is planned in the next hour, it doesn't matter who I am, how fit I am, what I eat, it's planned. But we don't understand destiny. So we leave it in the corner and we focus on what we can do.
Can I ask you a question on that?
Sure.
All the YouTube comments on my videos, when I say that don't eat the full restaurant biryani, you split it.
Yeah.
The first comment is that, for this, you can die. I better live whatever I want to. And then if I want to die early, it's okay. This is not what I want. What do you tell them?
See, I think it's a mindset change. The point is, fine. So you want to eat that much and die early, but you'll be happy. But what if you could still eat, not overeat it, share it, and live longer? You have a longer time to enjoy what you like to eat. It's a mindset change. So I think, as an Indian culture, we're very emotionally attached to food. And that's not a problem. It's a good thing. Because emotional attachment to food makes us happy. Rather than you've seen people on extreme diets, not eating this, not eating, and they're always so tight and angry and extremes and fighting. They have a bigger problem. Their anger and their own hatred is going to be their biggest issue. But the point is, I can be emotional with food, but what's my balance? What's my balance? Of course, splitting a biryani, then maybe you can do it again next week. Rather than doing the whole biryani today and then you're on antacids and you have all these issues and you feel horrible about yourself. So if you're a foodie, you should always ask yourself, how do I feel every day? It's not a short-term thing. I ate this, I feel great for 15 minutes, and then I'm like, acids, gas, indigestion. So the point is not making food the enemy. It's our mindset. Why can't I learn to enjoy in balance, in moderation? And of course, if I'm sick, there may be certain foods that I can't enjoy right now. But I do want to get better so I can enjoy them eventually. So it's nothing is written in stone. That it has to be low carb. It has to be high protein. You can never have sugar. I mean, I love talking with data. And when you look at the data of the longest living people, Dan Butner was on my show as well for the Blue Zones. He talks data. The longest living people are not are not nutraceutical junkies. They eat in moderation. They're not exercise junkies. They're happy people, great relationships. They have humor in their life. They know how to be grateful for what they have. Okay, everything is simple. Now, when you have data points showing you this, why does the other part of the world ignore this? Because there's business. I need to push a longevity nutraceutical. I need to push a way of diet because I can make it into a business tomorrow. But the data is clearly showing you, and now let's move away from his data to our data. Our longest living patient is about 101 right now, and then we have people in their 90s, and I'm constantly looking at their lifestyle and speaking to their children. What do you see in your parents? And they'll talk about things like that. They have routine, which they will do. Like making that cup of tea, brewing that coffee. They find joy in these things. Relationships. It doesn't mean all of them have been in their first marriage. Some of them in their second or third, but they've learned not to let those things kill them. They've learned from it and they've built something new using the lessons of the past. But today we're like, oh, divorce, oh, this, now trauma. Now, I'm not taking away from that. It's real. But my point is, how do you also use your past mistakes, failures, faults, lessons, and build? So it's not like the longest living people have not had issues. Some of them have gone through a bypass. Some of them have had enlarged prostates. But overall, the picture working for them is all of these things. Simplicity, emotional wellness. We can't say that the air is bad, the food is with pesticides. It is. It's dangerous, but we're all breathing the same air. We're all eating the same food, but we have different outcomes. So there is something working beyond that. Our mental state of mind, our emotional state of mind. So that's it. Look at the data points. There's so much confusion in the world. Take this supplement for longevity. Most people selling it won't live to even fight the lawsuit that comes up against them eventually because it isn't working. You know, I mean, I know science is progressing and finding these things, but don't ignore what's already working. How do you integrate what also is working rather than pushing it aside and saying only the new things will work in life? Because it isn't that way.
So you're big on emotional well-being, right? You're big on emotional well-being. So the first story that you said where the patient was very positive, the chemotherapy side effects was not that much. Is that the same as manifestation that what you talk about? What is manifestation and how should we use it?
See, I think, you know, the world has made manifestation a kind of an airy-fairy subject where people don't believe. But there's science again. If you break it down and understand manifestation the right way, it's as simple as what we believe. So there are 3 steps of manifestation, 3 steps. One is a crystal clear goal of what you want. And doctor, believe me, you walk around and ask most people, they don't know what they want.
What they want in
it's
life.
I want this, and then tomorrow I'll want this. The idea is crystal clear because you want this. It's okay if you're confused, but take some time to know when it comes to love, what do I really want? Most people will scratch this. I want honesty. I want a partner who does that. No. Beyond that, you'll probably get honesty in that, but you'll be getting a beating every day, domestic abuse and stuff like that. And I was like, have a crystal clear vision. And to know that it's a difficult process. You need to know you. So that comes to that 5th pillar of spirit. How do I operate from my higher self? My higher self or my ego? My ego is, oh, he has a car, I want a car. He's this, she's this. That's the ego. We're operating from the ego. That's a trend. Everyone's doing it. FOMO, I should do it too. Higher self is, what do I truly want?
How do we know?
There's a trend, but when we're connected with ourselves, what makes me happy? What brings me joy? I can go out every Saturday night and create happiness with alcohol, friends, and all of that stuff. Okay, but it's not happiness. It's pleasure. There's nothing wrong with that. But one day, if you don't go out partying, how does your life change? What do you lean towards? Like, let's go back to COVID where people couldn't do this. Now, what did their authentic self move towards? Some people moved into reading. Some built relationships. Some realized this relationship doesn't work out for me. Everything changed. Our higher self is truly what we want. Am I doing the job I really, really want? Am I in a relationship where I can be my true self? And because I can be my true self, I can now complement my partner rather than trying to change them all the time or my partner change me. So when we're operating from our higher self, okay, manifestation becomes easy. When we're operating from the ego, we're blocking.
So you take just some time to understand yourself. How do we do this?
I think it starts with spending time with yourself.
With myself.
Amidst. You know, looking around. 10 things in Mumbai can make you happy right now, momentarily. And that's why there's a difference between fulfillment and happiness. Okay, alcohol may make someone happy, but does it fulfill you? The answer will be no for everyone. It doesn't fulfill me. What fulfills me? Example, family, a relationship that I can derive from, a job that gives me passion. It's not a job. I want to be there all the time. I want to do this all the time. My health, my vibrations, my own vibrations. Like we know, like the lowest vibrations are complaining, blaming, pulling down one another, jealousy, hatred, anger. Those are the lowest vibrations. And if you notice, these people attract people at that frequency. Automatically. You're never going to attract anyone else. But as you start moving up towards maybe gratitude, which is the highest vibration in life is gratitude and love. I'm not talking about love for a partner, spouse. No, it could be love for a sibling, a friend, anyone, an animal. That's the highest vibration. Happiness, compliments, genuine compliments, serving one another. These are the highest vibrations. Who do you think you'll attract when you're vibrating? So you see, it's these little things that help us understand ourselves. So that's the first step of manifestation. Crystal clear goal of what you want.
I mean, fitness goals as well?
Absolutely. Absolutely. Fitness, weight, look, everything.
Okay.
2 is how are you going to feel when it happens, which now I move into an advanced state. Okay? Like when I get that car or when I get that job or when I heal this, I'm going to feel like this. Start feeling that already.
Even before the outcome?
Even before. Even before. It has everything to do with the subconscious mind. And the 3rd is surrender. You don't micromanage it. You don't get up every day and, I did this. No, it's set. The intention is set. Now you're going to feel. Now you start living in that vibration. That, this patient, fine, I've done my best. Okay, I'm treating this patient from a space of love, a space of care. Okay, everything starts to change. And then you surrender. These are the 3 steps of visualization, manifestation. So that when people say positive, be positive all the time. I don't believe that because that can become very toxic positivity. I mean, someone's got diagnosed with cancer. You can't tell the patient be positive. No, they have to go through denial, shock, anger. When they reach acceptance. Now they're in a state of response and action. But when they're not in acceptance, they're in reaction and no action. It's just emotional. How could this happen? I did this, I ran, I did all of that stuff. But when you're in acceptance, now you respond, okay, I got it. What's next? What do I do? You move into action. So you see, everything starts from the mind. The worst things and the best things start from the mind. People get into a relationship after years of, whatever, and now they're operating from a space of fear. What if she leaves me? What if he leaves me? Instead of being your true self and understanding that that's what got you together, now you're operating from fear. What do you think the relationship is going to be filled with?
Fear.
So, we have to recognize these things. But if I'm addicted to social media telling me how to love someone, how to drink, how to eat, how to parent, we're not operating from our authenticity. Like you have a lot of the Western culture telling Indian parents, don't sleep with your kid at this age, move them into a room, do all of this stuff. Now that may work for you. And you can see what emotional trauma it can create for certain kids when there's abandonment. All kids are not the same.
Right.
But in Indian families, you'll find certain children will sleep with their parents.
Correct.
3, 4, 5. They need it. They need it. Every child is different. And some are very independent. 3, they'll want their own room. They'll move out. They'll sleep. But you see, we can't put ourselves into a box. And that is where lifestyle and medicine has failed. Trying to put people in a box. Everyone sleep for 8 hours. How? Some people can sleep for 6 hours. It's the quality, not the quantity. Everyone go low carb. No, low carb isn't the magic answer to everything.
Correct.
Okay, high protein isn't. Adequate is what your body type needs. Everyone meditate for 10 minutes. Everyone do this. No, I may meditate for 20 minutes. I may not even meditate. I may take a walk in nature and get the same impact of meditation. But putting people into a box has put blinders on people, not allowing them to use their higher self and consciousness to think that, hey, I don't have to meditate. My relationship is so beautiful right now. I'm happy. Why do I need to meditate right now? Now, if it works for you, do it. But everyone's in a box. This spiritual part, this way of eating, this line. And that's the biggest issue because bio-individuality. We're all different. And see, you have religion, you have spirituality, and you have consciousness. I encourage people to move through all. But reach consciousness. At the end of the day, religion is great, spirituality is great, but it's your consciousness that is going to use the elements of religion and spirituality to bring action. So many people read self-help books or spiritual paths and they'll talk about these things. It's great. Well, you ask them if they're practicing it.
Probably not.
They're not. So the lack of consciousness.
So I don't practice as well. That's why I wanted to learn more about manifestation. So I always wanted like a flat abs, not six pack, but a little bit less body fat. So if I have to do morning manifestation, I should think that, okay, 3 months from now, I will get flat abs.
No, you don't think. You see it.
I see
You
it.
see yourself in the mirror
Huh.
with a six-pack. Manifestation requires you to do the work as well. Because everyone would be sitting out there like, I want $1 billion visualizing. We have to do the work. But the best part is that work is now effortless, which means I don't have to drag myself to the gym. Because I've set an intention, I do the work. I look after my diet, I work my core out, but I'm seeing that picture all the time.
And you do that at night or what? Like
Anytime. The best time to do it is just before you fall asleep, because between sleep and wakefulness and between wakefulness and sleep, your subconscious mind is like a sponge. It's most programmable.
Wow.
Most. So even before you get out of bed, you have to in your case, you'll probably get out of bed, give you a thanks, put your hand and say, I can feel that six-pack coming. And then you do the work, but it's not like you're going to be chasing. Oh no, this trainer said this. Let me find a shortcut. Let me take this anabolic steroid. This will help. No, everything will start coming to you. You'll get your perfect truth. That, hey, doctor, you're eating too many carbs. You're eating too much sugar. If you want a six-pack, you need to cut that down. You're training the wrong muscles. You need to train your bigger muscles. You need to do compound moves in the gym. You need to build more muscle. You'll start getting these little signs.
It will fall in place.
It falls in place. And then the effort becomes not one of resistance, that I have to go. Because now you're complaining. Oh, I want a six-pack, but I have to go to the gym. So you see how it breaks? So resistance is our biggest enemy.
Wow. And how long should we do it to become a habit like manifestation?
You just start doing it a little bit every day. It becomes a habit like everything else.
Everything else.
Like brushing your teeth or even the bad habits. Anything that's become a bad habit is because we got good at practicing it. Right? Anything that's going to become good, a great lifestyle, is because we got good at practicing that as well. So the subconscious mind doesn't know the difference between imagination and reality. It doesn't know the difference between a truth and a lie. And that's why it's programmable.
Wow.
That's why it's programmed. We have the power to program it with the story we tell it. So if you say, oh, but I saw on Instagram, after the age of 40, men have low testosterone, metabolic. It's impossible. Guess what? You've told your subconscious mind. But if you don't look at that, and you look at people who are 50 and 60 and 70 with six-packs, now you say, that post was wrong. It's putting me in a box. I'm not that. I can change.
You said something about thanks in the morning.
Yeah.
Is that the gratitude thing that you talk about?
See, I believe in thanks in advance.
Thanks in advance.
See, there's a beautiful concept of prayer where we can pray every day. I want a better body. I want more money. I mean, I believe once you've prayed with intention, the message has gone to God or the universe. So first is prayer. The second is thanks in advance. So let's say I prayed for great health. Now tomorrow, I'm thankful for great health. Thank you for the great health I'm receiving. Thank you for the great health that's coming my way. Thank you for this beautiful relationship that's going to come into my life. Not every day I want love, I want love, I want love. As you're moving from praying to begging. Now that changes your vibration. It makes you feel more inferior, like I'm all the time begging and stuff. I've prayed, I put my intention. Now I'm thankful in advance, which is the second step of manifestation. Crystal clear goal and start acting like it's already happening.
Wow.
So, it's just a state of subconscious mind and conscious mind. And that is the magic. That is the science of it. It's not an airy-fairy thing where you have to light 10 candles and do all of these things. I mean, you can if it makes you happy and peaceful, but it's not that.
It's not that.
It is the work that you're doing with your subconscious mind.
And when you talk about gratitude journal, that's different, correct? You at the night, at the end of the day, you thank for something that has happened during the day.
I'd like to talk about that as well, because that's also become a fad.
Yeah.
Everyone has fancy journals, and then you look at their pages. It's a great start. Don't get me wrong. I'm grateful for my parents. I'm grateful for this. And then after a while, you're not feeling it anymore. So I want to add feeling with gratitude. Like, let's say you had a great cup of coffee this morning. Okay. And at night now you're doing your gratitude exercise today. I want you to go back to that coffee, put feeling into it. What was so great about it? It's like the smell, the company, that moment, that coffee. Today everyone is, I love coffee, and they don't even know why they love coffee. Mostly it's because of the cortisol and adrenaline, and you feel good. Very few people would be the bean. Oh, wow. Now, when you feel for that, you're putting feeling and gratitude together. That becomes wholesome gratitude. So if I'm grateful for my family, what are you grateful about? Try to pick up a moment today where your family made you feel so good, or you just realize that I'm so blessed. Like maybe you met someone who doesn't have parents, and you now just feel, I have my parents. You put depth, feeling into that. That is true gratitude. And then you don't really have to just rely on a gratitude journal at night. You start introducing it in your day. You see something that you're grateful for, feel it a little more. Like you're standing out and you have the warm sunshine on your skin. Okay, you'll be thinking, okay, I saw Luke's video, I'm getting vitamin D, I'm getting shortwave, infrared, but now I want you to feel that light and just feel grateful for that light. Just feel it. That's real gratitude.
Wow. So example, like similar exactly what you said. Well, I started writing it. I said, okay, thank you for my son being in my life, right? And the next day, okay, thank you for this patient that I cured and everything. But after like 2 or 3 weeks, it just became
monotonous. So put feeling. So when you say thank you for my son, what is it about your son that made you feel so good? And feel that feeling. When you cured your patient, how did you feel? I want you to remember that feeling and feel it again.
But that's a work. I mean, you need to put effort into it.
Once you practice it, it becomes normal. Then you start to live with an appreciative mindset. Today, appreciation by most people are, hey, you're looking good. Hey, this is fine, that is fine, and stuff like that. But you really look at a person and say, I really love your dress. Because you're seeing beauty in it. You start training the mind to find real. Otherwise, you become like society. Go to a party, oh, you lost weight. Oh, you're looking good. Oh, you're looking that. And behind that, I say, this guy's put on weight. And you know what I mean? We become so used to fake society. And that's why you're further connected. That's why there's unfulfillment in society. Because people just say, everyone goes, I love you, I love you, I love you. But there's no feeling in it. You're just distancing yourself. And in your mind, you're creating a meaning of love in your subconscious mind as being very loosely used. You don't go around throwing these words, without feeling it. So it's not a lot of work, doctor. I want you to try that today where, again, if it's your son, think of something that warms your heart about your son. You've done it.
Absolutely.
And the beauty is then you don't have to do it over and over again.
Wow.
You don't have to do it over and over again. So people start living in a state of gratitude.
So are you in a state of gratitude now?
I think mostly yes, because that brings me calm. And I'm not the kind of person who can sit with a journal and write at night.
But did you start from there?
No, I started from there. Yes, I started from there, and then I realized, like you, this is monotonous.
Yeah,
it's not fulfilling me. But when I can really, I feel something, and I may just send a message to you, like I met you today, and I really felt this. I've expressed gratitude. I felt it. I don't have to write it 10 times in my journal now.
I'm telling you,
it's done. It's complete. The cycle.
If everybody does this, I think the world will be a better place.
I think everyone can start off with that because there's a lot of fakeness in our world today, and that's why there's hatred. Right? Most people are not themselves. When you're not yourself, the residual emotion is going to be hatred. It is going to be anger. But when we're our higher self, authentic, and it's difficult. Don't get me wrong. There'll be times I'll be angry. There'll be times that I'll realize that I'm being ungrateful. I am being ungrateful. Example, Mumbai traffic. I can be very ungrateful for that. But at the same time, the city works. It works. Everything is. So I have to look beyond that. So we all have that instant. That's why we need to keep practicing it. It can never be perfect. I can have a patient with attitude that disgusts me about them. And I'm like, I don't like patients like this. But then I have to remember the other 2 patients who are so grateful for their life change and focus all my energy on that. So we go through these ups and downs. And I think that's the beauty of life. We can never be perfect. We can never be perfect. But practicing a little bit, we start reaching stages of evolution.
You talk about the energy. So you, based on experience, you can figure out your negative energy, positive energy, and channelizing the positive energy to the place where you want.
With vibrations. The moment you start feeling like, you're complaining, you're finding fault, negative, taking it out on your team, the first thing, go to your thought, what are you thinking? And then you'll find it. It was one bad experience with the previous patient or something that brought up a past thing. It is the thought that is creating that vibration. Now, instead of going and trying to change everyone around me, can I change my thought? Can I move my thought? Why should I make everyone's life miserable because I had 5 bad patients today? What about everything else that's going well? So this is mindfulness really. Yeah. It all comes down to us being aware because we're allowed to make mistakes. We're not going to be perfect.
But we are so busy that we don't take time to be aware.
That's why we practice mindfulness every day. Yeah.
And it's scientific backing as well, right? Because it decreases the cortisol levels.
Absolutely.
And in your weight loss journey, cortisol is an obstacle.
Absolutely. For everything in weight loss, it affects, if you have excess cortisol. Cortisol is great for us.
Correct.
But if you have it excess and elevated all the time, it's a vicious cycle. It'll create a hormonal imbalance, which means your diet and your exercise alone is not ever going to work for you. Then it'll create issues with your blood sugar levels, your pressure. I mean, we know the mechanism of cortisol in the body. So it is important to look at all of these things. And that's why weight loss fails when it comes to just a diet and exercise. You got to look at the patient's emotions. You got to teach them and coach them how to start calming down a little bit, how to start accepting, letting go, because you can have the best food. We have patients who have the best food. They have their farms, they grow organic. They have a personal trainer, they have a chef. nothing works because their state of mind is their biggest enemy. And it's all connected with your hormones.
So what does Luke do in a very bad day? Let's say a patient comes in, does not appreciate you at all, the work that you do.
So I've learned the hard way. I would go home and do the usual thing that a human does. Take it out on the people that you take for granted. Who are the people you take for granted? Your wife. The people who live with you. Because they're there every single day. Your parents, your whatever. So I would take it out in the sense like, I'm not the kind of person who would go and just, like, if I saw 5 cancer patients today whose doctors have given them advice, oh, you eat everything, sugar, eat whatever and stuff. I would go home, and if I saw sugar lying in the kitchen, I would be like, why do we have sugar in the house? I would correlate if I had a child who was sick. Sometimes you get a 7-year-old child, absolutely healthy, and now you're looking at a tumor in the brain, out of the blue. I would go home, you have a child, you would start literally like, why is this like this? Why is this like this? Reaction. Because my emotions are out of control. And that's when Daji, in Heartfulness, taught me one simple thing. He said, before you leave your clinic, you have to do that 10-minute exercise. It's a beautiful exercise he teaches, where we let go of all the negativity. You got to clean yourself before you go home. Like we clean our shoes.
Correct.
Before entering our home, or we leave them outside the door. We don't want to take dirt in our house. So Daji personally taught me that method, which I now teach my patients as well, because all of us go home and take our problems.
Correct.
So I think that's really kind of helped me, and I've learned through my own evolution. I think you learn to be calm, where you want to put your energy. Because if I've gone home and created negative energy, what am I going to get back? Negative energy, right? Negative energy from everyone. So
I do that personally. Daji is Heartfulness meditation, the leader, and I follow Heartfulness. And for the cleaning method in the evening, so I come from the office, and before entering the house, I park my car and I do that cleaning in the car. Because it's a completely different mindset.
Absolutely.
Getting into a family and then before at work. Absolutely. And then the kids are screaming so loud inside that sometimes I stay inside the car.
Sometimes you got to distance yourself wisely from the, we're never going to be bulletproof, to get into a war zone and then expect ourselves not to be, provoked. So sometimes distance yourself, okay, so, like sometimes like, okay, the maid's not come, there's nothing cooked and stuff like that at home. I'll go or eat my meal and then go home. So I don't have to get into what do we order, what do we do and stuff like that. So sometimes we're allowed to do those little things.
Why is meditation not attractive to patients? Whenever I say you need to meditate, people are like, okay, I will do that.
I think because again, the way it's pushed down on people, nothing should ever be pushed down. Religion, spirituality, medicine, nutrition, no. Because it creates an immediate resistance, right? That, you have to do 45 minutes. Why would you tell someone who's now just trying to get into meditation that you have to do 45 minutes to get this? Start off with 5 minutes. Make it attractive. Make it based on self-realization that, hey, listen, it may not work for you. Let's do 5 minutes for 1 week and now sit with me and tell me how you feel. And now you're involving them rather than putting authority. It's like, look, I feel great on these days. Great, let's try 10 minutes next week. You coach people into change. You never use authority. Even with medicines, patients will come like, Luke, the doctors give me all these prescriptions, all this. I hate medicine. I can't do this. This has a side effect. I Google it. Okay, fine. Now let's talk about everything. Break it down. Coach them into understanding that you need this. Yes, every medicine has a side effect. Let's see. This steroid now is going to deplete vitamin A, vitamin C, zinc. But we are going to now eat foods that contain this. So you're going to be fine. But the steroid is going to bring your immune system in place. You have an autoimmune condition, right? So you coach them with understanding. Everything, even meditation. Today, everyone says, if you do this for 1 hour, your life will become like this. It's not necessary. It doesn't have to be that way. So we believe in small wins.
Small wins.
One baby step at a time. Let it become, it serves you, great, now I'll do it more. But that's why exercise, today people are reliant on motivation. Why should we be reliant on motivation? Motivation is for people who have not yet decided that I want to achieve this. Then you're inspired. We need to work with inspiration. But because it's become a product, exercise, motivation, look at this person in the gym, muscle, you think, no, I have to look at it differently, okay? I need movement and exercise because it looks after me, this. Now, what is the best way to do it? Let me start with a walk. Now, let me do a few push-ups. Now, let me do this. I want to experiment with the gym. I went, I love it. Continue. I don't like it. Don't go there. It's not the end. But baby steps, people have to be coached into it. At every level of life. Even a 70-year-old person has to be coached. We can't assume that they're mature and they're, senior citizens and all. Even they need gentle coaching because the human mind has so many preconceived notions that have to be broken down.
Wow.
And that's why coaching is such an important part for everything. Wow. You have mentors who help you with your finance. You have mentors who help you with, I have a mentor too. Because sometimes you need someone looking over you to say that, Luke, you need to move in this direction, or you need to do this. So I think it's always nice to be coached and to coach people out of, their problems.
You're talking about the accountability factor?
Accountability is one of it. And two is them showing them the mirror always. Reminding them why are you doing exercise? Not because your friends are doing it and you're feeling bad, because your body needs it. Why are you eating great food? Not because Instagram says so. It's because these are trillions of cells. They get the right food, they send the right message. They get the wrong food, they send the wrong message. So you have a hair fall problem. Why is your hair falling? Where is the communication in the body broken down? Why are you growing a tumor? What is communicating with cells to grow the tumor? Why is angiogenesis out of control in your body? It's communication. All hormones are messengers. They're either giving you the right message or the wrong message. It's like fertility and infertility. The message is wrong. Everything is everything to do. Why are my blood sugar levels rising? Insulin response. It's a message. Insulin resistance. Why are my cells sending a message that close up, don't take in blood sugar?
There's something wrong.
There's something wrong. So the point is how do we, correct communication? Every relationship that is bad in life, whether it's with a parent, a loved one, is because there is a breakdown of communication. That's number one. There is assumption. There is entitlement. He should think that way. She should think that way. But when you communicate, everything changes. So right communication, right message. Wrong communication, wrong message.
And the communication can get better with gratefulness, gratitude, meditation, sleep.
Yeah.
And you talk about forgiveness. Please educate us. What is forgiveness and how do we adopt in our lifestyle?
See, it's a very difficult thing. And that's why I always say I never preach about forgiveness. Because if you give me 3 instances right now, I wouldn't know how to exercise forgiveness. Like when you read about a young 4-year-old girl who's been raped, how do you forgive? So I don't know those answers. But for everything else, like he hurt me, she hurt me, all of that stuff, it is one of the most important parts of our health. Like any cancer patient who comes to me, the first thing we will talk about is what suppressed emotions are you holding? Resentment, guilt, unforgiveness. I mean, there's science on it. When you look at the work of Dr. Gabor Mate, where he talks about, and we've seen it in our patients. I've had emotional breakdowns where our patient has finally forgiven. And they will cry and they'll cry and they'll cry. And then you look at their recovery post-stat. Everything changes. Every single thing changes. So I think about forgiveness, the first thing we need to understand, it's not for the other person. It's for you. You are forgiving for yourself to let go. And, I ask people to reflect. Okay, you're in a state of unforgiveness, but the person that, you're not forgiving, look at their life. They're living. They're on the beach, they're here on holidays, and you're getting... So who's getting hurt? You. Now, there are many, many ways to start the process of forgiveness, but a lot of people don't forgive also because of their pride and ego. How could she say this? How could he do this? Why not? When you separate the human brain, the same brain that is capable of good is also capable of evil. The same brain that can serve society can go and murder a child tomorrow. There was a trigger point. That's the human brain, and all of us have that. We have a dark and a light side. We all have the 7 deadly sins.
Right.
It's what we feed, it's what we nourish, it's what we channel. If I nourish anger, I'm an angry person. But it doesn't mean I can't have anger. It's part of the human spectrum. And there are a lot of people who pretend I'm spiritual, I'm calm, but inside they can't forgive, they're resentful, they're angry, because they're not respecting the human spectrum of emotions. Every human being will have lust, will have jealousy, will have greed, will have gluttony, will have anger. But the point is, we're aware of it. Now, I don't let lust become a crime. I don't let lust degrade a woman or a girl or a man. I don't let it come to that level. I don't let jealousy make me negative about myself. If I'm jealous that my friend has a car, I can use it as a message. If I want that car, put in the work and get it. But I've changed jealousy to a message, action. But sitting and being jealous, oh, he has black money, that's how he got it. It's not serving me. He's still driving his car and enjoying his life. But if I'm jealous, I'm understanding the feeling that, oh, I do want that. I want to be like him. Work for it, get it. Aspire, earn money, buy it. I've used jealousy, a negative emotion.
It's a positive.
I've changed it. So you see, that's how we channel it.
But how do we get help for this? Can somebody do it by ourselves, or should we have to go to a
It really
person
depends
like
on the
you?
depth. It really depends on the depth. Like I have my limitations. I can show the mirror to people. I can help them with techniques, but some of them need counselors. They need to move into therapy. You know, because a lot of them have childhood issues. I can't solve that. I'm not a psychologist. I'm not a psychiatrist. I'm not at that level, and I don't give medicine for that. But the point is, sometimes we reach a patient where showing them the mirror, giving them tools, they start practicing it. They don't need it. Some need it immediately. Like they're dealing, like, you know how many Indian women we have who have been raped, who have been molested.
Oh my God.
Great families. They're suffering with cancer today, and they've lived their life because they can't tell anyone. Who do they tell? A young child who's been raped or molested by an uncle is told by their parents in our country, don't you ever tell anyone because no one will marry you. Now that girl has grown up, she's attracted the wrong relationships, or she's in the right relationships, but because of her fear, she can't give. She can't be who she needs to be, and those relationships break up until they finally address the point. They express it, they talk about it. They need counseling. People who have emotional, deeply rooted trauma, of course they need the right professional for that.
You know, many people have told me that the weight gain, I strongly feel that, you know, they're failing in weight loss journey is tied down to these deep emotions.
Of course, for weight gain, especially abdominal fat, is insecurity. And when you go into the lives of these people, and of course, there's also gluttony and greed. You're just eating. Don't blame it on the emotion.
But you put in all the effort, but still you're not getting.
For people who are putting all the effort and not, they have to look at emotions. Where have they been insecure? Sometimes their relationship with their father was broken. So a father gives a sense of security, or the mother. Sometimes, you know, I'm not here to blame parents, but, you know, if your parents have not healed before having a child, you know, their suffering is going to come out on the child eventually. But the whole point is we need to recognize these things, and you need to look at that. So a girl or a boy holding on weight, when you really get into their emotions, there's either something wrong in their childhood, there's something wrong in their relationships, or they've built these blocks. They've been in a relationship where they were abused or called fat or called whatever. Now they don't have security. See, when the body feels safe, everything works. When we feel unsafe, the message going to trillions of cells is very, very different. Like, I mean, I'll give you a simple example. I mean, you know, we can prove this with science, or we can prove it with a simple exercise right now. When we're happy or when we're joyous, how do we feel?
Feel
our
excited,
bodies open up.
opened up.
The moment we feel angry or insecure or safe, posture change. We're like this. We're
It's a sense of like chest compression. I mean,
how is
tightness.
this happening? Trillions of cells are responding to a thought and an emotion. So I can say something to you that makes you angry right now. Every part of you will change. Your posture, your whatever. And see, that's where people have to realize the impact of their emotions. And if you need help, please take that help. Because sometimes it's not the diet that's going to fix you. It's not the exercise. It's that emotional void, or it's that trauma that has to come out. And when it comes out, your body starts to behaving in balance. And now your efforts for weight loss will actually start showing results.
Wow.
Like the liver and anger. No matter what anyone says, if you look at the data of people who have cirrhotic livers or any liver problem, they will be irritable people. They will be angry people. Prostate as well. Again, I'm not saying this is the only thing, but you have to look at several factors. And when you come to the emotional part, there is a corresponding emotion with that particular condition.
Wow.
So you have to address it. Please take your medicine, do everything. But for the emotional part, you need to see all these things.
Wow.
You know, so tomorrow my dream for an ideal world is when the doctors and professionals are equipped with this, they're able to write a prescription and say, okay, yeah, you have prostate cancer, you need this, but listen, I need you to be a happier person. You will get better if you change your emotions as well. Now the patient goes back to, hey, it's not just the chemo. I also need to start making other changes.
Wow.
That's when the patient really, really benefits from a holistic treatment.
Approach. Super. So Luke, you know why I'm asking all this? It's not for my audience. It's for me.
We'll send you the invoice then. Thanks for letting me know. I'm joking, doctor. Yeah.
So I strongly believe that every parent should train the kids in everything what you said. Okay. So I have two kids, 6-year-old Arjun, 4-year-old Atharva.
Nice.
So they sleep together with me, and we all 4 of us, we sleep together. And then that's the only time I get with them as well, which my wife is not very happy about. So I play with them. I'm the fun dad. Okay, but all the hard work is done by my wife. I'm the fun dad. So I make them write gratitude journal.
Beautiful.
Okay, and I say, okay, Arjun, what are you happy about? He says, I'm happy about the ice cream that you didn't give me. So I make him dictate into the phone and then say, oh, I am happy about the ice cream. Right? So I strongly feel that empathy we need to teach the kids. Yes. In your practice, what are the other things that we can make the mental health stronger in kids so that when they come up to an adult stage, they don't have to go through all these things that we are going through?
Yeah. No, so absolutely. I would like to be very honest when I speak about these things. Again, because whatever change we're trying to make today as a society, community, children, parents, you can't build on a system that's already broken. First, we got to fix that. And what is broken in the system? We've become emotionally weak. Not we, most people. Society's become so emotionally fragile. Like, I'll give you a simple example. Mr. Murthy made a statement about a 70-hour work week. He just made a statement. He didn't come and tell every company you'll have to work 70 hours. But look how everyone woke up like it's become a law. So emotionally fragile without trying to understand the essence of what he says, without understanding that my power is, I won't work a 70-hour week. I'll change my job and I'll do what I want. But you see how emotionally fragile most people started reacting. What about work-life balance? And I'm thinking people who don't even work 4 hours a day don't have proper work-life balance because they're mostly on social media scrolling and they don't have any work-life balance. But the point is, look how emotionally fragile we've become as a society. So if we're trying to change the foundation that we're building on, we need strength. Strength doesn't mean we don't respect weakness because everyone's going to be different. We have strength and we have weak points. But mental health today is broken because of this emotionally weak, fragile mentality. We become so sensitive, so sensitive to everything. Now, sensitivity is good, but being in control of your emotions is also good. I can't just say, look, I had a bad day, I'm depressed. You're not depressed, you just had a bad day. I'm depressed, my loved one left me. Oh, you've had a bad love story in your life right now. You're not depressed. Clinical depression is very, very different from the way people go around labeling themselves as depressed. Now look how children are talking. Oh, my mom, this happened today, I'm depressed. You mean you're depressed? Your teacher pulled you up for not doing your homework. Focus on the fault. You didn't do your homework. Don't focus on how are you feeling this way, Luke? The teacher said this and my child is... Let's go back. Was the teacher right or wrong? The teacher was like, but my son is feeling this way. You see, the point is we're making excuses for the wrong things because we're scared of taking the right action. We're trying to conform and grow more and more people who are all like, let's react to this. Mental health has to be built on a foundation which starts from the parents modeling it. We can't. If a parent goes home and is emotionally all the time, what do you think the child's going to do? You may give them a pep, not you, hypothetical. Someone may give them, just anyone. We may go to them, give them a pep talk that be kind, be grateful. But then they see us in our conversations with other people not doing the same. The lesson is broken. We have to model it. Our teachers have to model it. Schools have to model it. And eventually society has to model it. We're teaching our children stuff. And then we're allowing them to watch trash TV programs, which breaks every part of the lesson you're trying to teach them. Who's going to win? The TV show, dopamine, the way it's presented, the kind of people they use, the language, it's going to win. We're not going to win.
But you cannot win social media.
Exactly. So what we need to do is realize what is the time of the in life that we expose them to social media. See, I'll tell you something, I talk at YPOs around the world and all of that. Every chapter is very, very different. I'll never forget the New York chapter. All billionaires, okay? The first YPO when no one wanted to talk about weight loss, health, they were super fit people. So they had just one issue, social media.
Wow.
You have everything in the world, but that's destroying their life and their children's life. Now, the point is, I can't say social media is a bad thing.
Correct.
It is always the person who's using it.
Correct.
Like, I can't say alcohol is bad. It's the person who's using it. My 101-year-old patient will still have a peg of whiskey every night and has no disease, is 101, compared to people who are 20 and 30. The problem is not the alcohol. The problem is the person behind the bottle. How much I abuse it, how much I drink, I don't know my boundaries. wrong intentions of drinking. I'm drinking because I need to be cool. I'm drinking only because when I'm high, I can have conversation, because otherwise I'm so spoiled by social media, I don't even have social skills anymore. You see? So social media is not the problem. You've taken it and you've built something beautiful out of it. Other people take it and it destroys their life. Everyone can't be on social media. Sometimes I get really sad when I see a lot of people on social media, look, I'm in depression, I'm clinical depression and this. And my first question is, you're in the wrong place, firstly. You're not supposed to be on social media. Please understand. That's going to make you more depressed. You're already in the wrong mindset and you're seeing crap. It's going to make you more depressed. So when it comes to that, we can't change these things. But at the right age, if you start teaching your children, you can't even tell your children social media is bad. You tell them it's bad, they want to watch it more. Like a lot of parents, never watch pornography, never do this. Do you think the child's going to wait to watch it? But you teach them. There is this. You are going to see pictures of naked men and women at some time. It is going to happen. And now you get a chance to explain and educate them on what it is, rather than creating fear. Like I'll say it openly, like parents come, look, my son said the F word. I say, so what? They're listening to it in music,
Correct.
Unconsciously seeing it. Why are you making it? Take the thrill out of it. Sit them down and teach them there is a word called fuck. Okay? This is a word that you don't use. It's disrespectful. When you hear it, take the thrill out of it. You take the thrill out of it, it doesn't become interesting to a child. You talk to your 12-year-old kid about marijuana, joints and stuff that they need to. Rather than the wrong people teach them, you've taken the thrill out of it. Children are smart. They still may want to try it, but there will always be consciousness and awareness. I remember my dad, because we lived abroad, and when we came to Goa, this was 30, 35, 40 years ago, it was the hippie time. Everyone was rolling joints at the hippie time. My dad was like, oh, shit, the culture, like you're living in the culture, so you're more susceptible to getting into it. And my dad comes home and he rolls a joint, sits at the table and says, come on, this is a joint, this is this. I was probably in, I don't even know, maybe 11 or 12. He just took the thrill out of it.
Wow.
So when my friends started rolling, I was like, what's the big deal about this? Everyone's running and, the thrill was out of it. You know what I mean? It made so much of sense that rather than create a fear around it, because you're in a society where there is alcohol, there is drugs, there is sex, there's everything. So rather than operating from a space of fear, sit them down, consciously teach them about these things. Take the thrill out of it. And then you create communication where they will come and they'll say, hey, Dad, I did see something. There were like 2 people, they had no clothes on and they were doing inappropriate stuff. Sit them down rather than, who's that kid? Let me go. It's school. How is this happening? Down. Yeah, this is real. This is life. This thing happens. And then you get a chance to educate them on it. And I'm telling you, this is the job of parents to do it. And if you can't do it, maybe every parent can't do it. I'm not here to say that. Then you go to a counselor who can teach them that. Or maybe use the grandparents who can teach them. You know what I mean? Use someone to teach them. Not everyone has that ability and that skill.
But what age are we talking about?
So I'm a fan of the subconscious mind. I'm a student of Dr. Bruce Lipton, so I will always talk about that. From the time the child is born till 8 or 9, their subconscious mind is like a sponge. You get to program it with what they want. So you put the right stuff in, it's for life. They may still try stuff, but you're driven by what was in. You teach them the wrong stuff, it's going to be their life. So you tell a child they're stupid, they're ugly, they're horrible, no matter how pretty and smart they may grow up to be, they will always feel that way because it's in the subconscious mind. You can't change it. At any age, you can reprogram, but you get what I mean. Yeah. So 0 to 8 to 9. Now the beauty is if you've allowed your child's imagination to unfold, like you allow them, like my daughter still believes in fairies and pixies and God, that's imagination, they're still programmable. But if you like, Santa Claus is not real, this is not real, that's not real, you've already started putting layers. Their conscious mind is growing stronger. You're losing out on a chance to program them.
Wow.
So I'm open about these things. When my daughter was 4, she could listen to me. She went, I've thought of every possible bad word. She knows every possible bad word that you would hear in a song or that a child would say in school. Everything. She knows the word, how it sounds, how it looks. Okay, not possibly what it means, but how it's also disrespectful. So today when she says, hey, Dad, to some parents came because someone said fuck in school or whatever, like, she already knows it. She's educated on it. We don't have to do everything because the world's changing. Now, probably 30 years ago, I wouldn't do it at age 3. I've had sex education in detail with her, every single thing. How are babies made? What's going to happen? Because children learn. They're very curious. You involve them.
Young age, like 6, 7?
Absolutely. Because you know what? They're going to get the wrong answer or an answer which is distorted from a person who's not their parent. So you teach them. You teach them. Go back to the time we were in school. You always had 2 or 3 students who knew it all, who were allowed to watch all programs, and they were the cool people. They knew everything and stuff. We looked up to them to learn because we looked at them in awe. But that's the wrong source of learning. So as parents, we get to teach them all of that stuff. And then children start to ask the right questions. They start to relate. They are such intelligent creatures. It's insane. So involve them. Like, I don't teach my daughter, don't have Coca-Cola, don't have junk. No, they are going to do it. You educate them about it. That, a lot of people have it. Taste it. Now, this is the bad
food.
Now, would you like to put this in your body? Make them give you answers rather than telling them, if you put this, you'll get cancer. If you put this, you'll get diabetes. And then when they realize, they start to relate towards it.
Correct.
You can't tell people, people pay me, like they bring their children. They take a consult, and this is when I get really angry. There's no disease. But you need to tell them to stop drinking Coke. Okay, the money is easy, but sorry, that time needs to go to a patient who really needs it. That's your job as a parent. And I'm not going to tell them. You want me to teach them and encourage them and stuff? I'll do it. But are you going to model the same thing at home? Or are you going to say, when they drink the next, Luke told you not to drink? Rather than, you know what I mean, right? The system's broken.
No, absolutely.
So this is what I mean by it's possible, the
to new program at that young age.
Absolutely. Every generation has been messed up in some way or the other, and it has its goodness as well. But the current generation that we have below us should not become products and victims of social media and the wrong messages.
Right.
And the wrong messages.
So I'll talk about social media. Before that, I want to explain a situation. So, at home, I had an argument with my wife. My 6-year-old saw that and then came to me and then said, why are you shouting? I think the way that we are practicing is clearly replicated. And then he's asking, okay, so, why are you shouting now? What did he do? This is not right. So modeling to our kids is a huge thing. And that comes to the sex question. We are on social media. And the kids are on social media. What is your take on digital detox?
I just want to go back to a simple point. See, arguing with a spouse, all of that it's normal. And sometimes kids have to see it so that they don't believe that everything in life is perfect. But what you do out of that, it's beautiful how the kid comes and asks. So I teach parents to do this, and I personally do it as well. Ask your children for feedback sometimes. They come up with the most insane, and then they feel involved that, oh, my dad asked. And say, like, I had this argument. Maybe I could have been calmer. What do you think I should have done? My daughter will say, hey, you can speak kindly. You can speak whatever. Now they feel involved in the process, and you're only building a better bond with them. Because the point is, of course, we're going to fight. Of course, everyone is. We can't also show children that everything's perfect, and then tomorrow they get into a relationship, and there's a fight, and they're like, they don't know what to do. But they grew up parents, but they also see how we reconcile. They also see how we apologize to one another. So we get to teach them that's life. It can't be perfect for them, right? So coming to digital detox, I think it's the most, like I said, we can't be off social media, but I think a couple of, it was last year, we did a digital detox. We had millions of people from around the world.
Correct.
Just 7 or 8 days, everyone off social media completely. We moved into a Telegram group just to be a support function. Just remind people, by day 2, you even wonder why you were ever on social media. See, it's dopamine at the end of the day. It's dopamine at the end of the day. So I'm saying be on social media, but be mindful and conscious. And one day in a week, can you be off it completely? Because then you're not allowing addiction to happen. Or 5 hours a day. Fine, my work may be 5 hours a day on social media. How can I bring it down to 4 hours a day? How can I make sure that when I'm going on social media, I'm going with intention? I'm not going, if I'm going without intention, scrolling is obvious.
So tell me an intention example.
So an intention, I'm going on social media because I want to learn from this person who posted on testosterone. Now I go over there and stuff like that. Or my friend says, hey, we got married, please check out our pictures. I go over there. And I'm also mindful that the feed is now going to throw me similar stuff. But is that what I want? No. So consciousness. If I'm going in with the intention to see who wore that at a party, who's doing this, which fad, you're just going to be pulled. The system wins. So I think a digital detox also helps us realize that there is a real world besides social media. And that's what happened in the 7 days. People were like, my own team were like, I don't want to come back on social media. Our patient, we don't want to. So I said, if you don't want to, you don't have to. But at the same time, if you have to, can you create these mini detoxes? Like on the weekend. Why do you need to be on social media on the weekend? And maybe it's your only free time, so you want to. Then select a Tuesday and Wednesday in a week. Or start off with one day. Or start off with everyone's phone tells you how much of time you spent on social media. Put that as your target. This week, I want to bring it down from 6 hours to 5 hours. Baby steps. Baby steps. But everything is intention. And the point is, we've learned as a community, we can't be okay without doing anything. You're even waiting for a bus, you're waiting for a train, the phone is on. You're waiting to get off an air flight, everyone's on the point is, I'm not judging anyone, I do it too, but my point is, with mindfulness, we realize how addicted we've become. We want that dopamine to continue. So a digital detox makes you self-realize that, hey, there are so many other things I can do. So in that 7 days, when thousands of testimonials poured in, we asked people, what did you do? People started spending more time with their kids, with their loved ones. Some went for treks, and they will realize, by immersing yourself in nature, people realize that I really like this. So they found other things to do other than just social media. So I recommend the digital detox, all of us. I'm not here to preach 7 days, 10 days, 5 days. Start off with a day and see how it feels. It feels incredible. And the best thing is, find a group of people. It's always nice to do it with someone. So you feel motivated. I think it really worked because there were 1 million+ people doing it together. So everyone knew that, and we would check, how are you feeling today? And someone would say, I'm feeling amazing. Then other people, yes. Oh, I put it on by mistake, but I got off completely. So, you feel accountable to one another, and you just feel, I'm not doing it alone. So it's nice as a baby step to start off, but I believe a digital detox will be
for the kids as well?
Everyone. The kids more.
Kids more.
I mean, adults can't handle it, so imagine kids. Right? I mean, it's the dopamine, and people are burning dopamine, and that's the biggest scare of it. Because you're burning so much of dopamine, what happens when we have less dopamine? We don't feel inspired. We're bored. We need something to happen. I'll tell you an inspiring case during the COVID. Okay, I had a family that came to me, of course on Zoom, and their 3-year-old child was detected and almost put into a broad spectrum autism. Okay, I looked at the child, all of that stuff. I said, yeah, whatever, and then in the diagnosis, the child is on the iPad for 9 hours a day. 9 hours a day. So I told the parents, I said, listen, you can take your diagnosis, from your professional in autism. I said, give me a week, okay? Whether your child has autism or not, 9 hours on an iPad. Because we saw social skills. He could not even communicate with humans anymore. He was imitating like Peppa Pig and all of that stuff from the iPad in his daily life. It was becoming him. Remember, the subconscious mind, programmable. The parents said, we'll do anything. They took away the iPad. Dealt with tantrums for 2-3 days. 9 days later, every single symptom disappeared. Wow. He would have been put into a bucket of broad spectrum autism.
Wow.
But this was an inspiring story. The child's grown up, social skills have come back, all of that. Parents have realized that because COVID, no one knew what to do. How do you keep your children busy?
Correct.
But now, what does that teach us? You go into any case of autism, okay? They're not all the same. But your iPad time plays a huge difference and role in them. So, that's how we get better in medicine. That's how we get better. We learn. And we don't just hide behind a drug or a therapist for autism or nutritious foods. We also look at how much of time is your child on the iPad. Now, let's reduce it. Is there a change in their behavior? Parents will say, look, yeah, there's a slight response. So you see, that's why we can never say we know it all. We're constantly learning from one patient, trying it with the next one, training the team over and over again, because that's how dynamic human health is.
You are looking from holistic approach, right? Yeah. All the things that we discussed so far is not like the fashionable, sexy, attractive things. All this is like a big level discussion. So in the big level discussion, does fasting play a role in the big level or at the molecular level?
Absolutely. Absolutely. And see, fasting has always existed. It just takes someone smart to package it really well, add some science and research, and great. At least they're doing something good about it. But think about it. See, there are 3 cycles in life. There is activity and rest, there is sleep and wake, and there is feasting and fasting. These are 3 cycles for every human being. If you can perfect these 3 cycles, mostly that is your preventive model. Fasting is therapeutic. It's not. Now look, and this is where I talk about cultures. Our own Indian culture has so much of wisdom, and yet you have the sickest people and the people who are the least inspired imitating the West all the time. I'm not against the West. We can learn, but also don't forget you can learn from your own culture. Fasting originates here. Yoga originates here. Pranayama originates here. It's not that we're better than the West, but I'm just saying don't blind yourself by only thinking, what is intermittent fasting? It is a fad. And I'll tell you why. It is fasting. Why do you need the word intermittent? 2, why 16-8? No one's really questioned that. Why not 15? Why not 15 and a half? Why not 17? But you put everyone into a box of 16-8. We have patients who get fantastic results or better in 12 hours of fasting because that's what works for them. Our pro athletes, our cricket players, our soccer players, they don't fast 14, 16, 18 hours. They'll do 12 hours because they're already fit. They can't break down more muscle. You have to do what suits you. But fasting is therapeutic because the biggest problem in our country is people have an abundance of food. You know, and we all know that when we're not eating, the body's repairing. When I'm eating, I'm not repairing. But when I'm not eating, my body's repairing, regenerating, growing, everything, all the magic of rebuilding and building is happening in a fasted state. Look at Jainism in our country. Such a scientific, beautiful process of circadian rhythm. Sunset, stop eating, stop drinking water, 12 hours later, which is easy. Start doing it again. May not be practical for everyone, but at least we can adopt the concept. So the point is, rather than pushing hours onto people, okay, teach them what happens in time-restricted eating, because the point is everything's a rhythm. Heart, rhythm. Pulse, rhythm. Breath, rhythm. Brain waves are also a rhythm. So the point is, if I'm eating at different timings every day, I'm creating a disruption in my own digestive rhythms, my hormonal rhythms. But if I say my eating window is between this time and this time, whether it's 12 hours, 8 hours, 6 hours, doesn't matter, whatever suits you. Now you create a rhythm for the body. Everything becomes easier. Like sleep. If you go to sleep every day at 10 o'clock, make it, after a while, you will automatically sleep at 10 and you will automatically wake at 5 because it's a circadian rhythm. So fasting is therapeutic. And I tell all people, start off with 8 hours. You'll say, hey, Luke, this was easy. Now do 9. Now do 10. Then reach 12. Now people will say, but Luke, I can go to 13. Okay, find your average. Like, so my average is anywhere between 12 to 14. It can vary. Once a week or maybe once in 15 days, I'll do a 24-hour fast because I travel so much and, you know, eating outside food. And that's my threshold. But 12 to 14, it'll be very different. The days I probably do a more heavier workout, my body's going to ask me for food before. Why will I keep myself in a box? I'll adapt. And the days where, let's say, I've been on a long flight and come back, I probably go on to 15, 16 hours because I'm jet lagged. But I'm following hunger. When my body tells me it's ready for food, I will eat.
And your patients have told you that fasting make them better?
Oh, absolutely. I mean, we have today, which is being studied across medical institutes and cancer institutes around the world, is even our patients who do fasted chemo cycles.
Fasted chemo?
Zero side effects. Zero side effects. And the science is simple. It's a sparing action. See, when we're in a fasted state, your immune system is on the lookout. It's in protection mode. Everything changes for you. You're going through chemo, you want to have an immune system which is, it's more protein sparing, it's everything in place. And now many patients, it's not for all. Some can do it, some can't do it. You have to assess the patient. Some feel that if I don't, I'll get weak, I can't take the chemo. And some are like, they don't even eat 12 hours after the chemo, no side effects. So you can't put it into a box and say, fasted chemo is great for everyone. You can't do that. But it is therapeutic. And there are some patients who can't fast. They're not supposed to fast at this stage in their life. You've just had a transplant, you're an immunosuppressant, or you have highly fluctuating blood sugar levels until you bring some normalcy. At the same time, we have fasting, which is reverse diabetes for patients, right? It changes. And for some patients, until you bring normalcy in their levels. So it's not for everyone. It's not for the woman who's just delivered a baby and has peer pressure to lose that weight, so they turn to fasting. No, you're lactating. You need energy. You know, it's different for everyone. But fasting is therapeutic to the human body, whether it's longevity, lower inflammation, cognitive. We see our Alzheimer's patients who start fasting, their response and behavior starts to change. You know, so it is therapeutic, but again, you can't put everyone into a box. And I have some of my fittest patients who don't fast, and they're absolutely fine too. But they keep that minimum gap of 12, which believe me is so easy. I eat at 8 o'clock. I shouldn't be eating before sunrise. I can easily wait till 8 in the morning. So I'm automatically doing a 12-hour fast.
I tell them it is for everybody, including all my audience and also all my patients. All the GI symptoms improve significantly.
Absolutely. Oh yeah, absolutely. But the gut starts to get better with that. Because it gets to have a space of no work. Rest. And in a state of rest, the body has an intelligence which no scientist has, no dietitian has, no doctor yet has. the way it balances its fungi and its bacteria and the microbes. No one. That's why we say sometimes the overuse of probiotics is also messing people up. Oh, look, I got 50 billion from the US.
Right.
I'm like, your gut doesn't need 50 billion. Right. It needs to stop doing these things. It'll automatically repair, but that's how it is.
Based on whatever we have discussed now, right? So all this you're talking about is a lifelong thing, and you do like one step every day.
Yeah.
And that's what you are written in your new book.
Yes.
All right?
Yes.
Tell us about the book and what have you written.
I got a copy for you in that bag.
Oh, please.
It's just small wins every day. What we did was, sometimes as a practitioner, you get fed up. You're seeing the same patients every day, telling them the same thing, exercise, do this. And then you think that you want to spend more time with the patients who really need help. So what we did is, we said, let's go into our data for 13 years, look at all of our successful patients, and what are the things that they were consistent with. Like whether it was their morning ritual, whether it was their Surya Namaskar, whether it was, whatever. We took out all the commonalities for the day and we put that into a book. We just took 100 wins that worked for people. And a month later, we were a national bestseller.
Right.
Because it's doable. People can open any page and say, well, let me do this today. And then there's small wins. So teachers say, do it tomorrow, then do it tomorrow. Now we have so many people from across the country getting off bed and moving straight into a Malasana position. Sitting there for 30 seconds and then starting their day. Something as small as that. And we have people saying, hey, Luke, my bowel movement's gotten better. I'm not saying everyone with constipation, this will solve your problem.
Correct.
Remember bio-individuality.
Correct.
But great, it's a start. It's a start. So that's what the whole book was about, to encourage people to our most complicated diseases, patients are coached with small wins.
Small wins, yeah.
Start doing it a little.
Especially the emotional part, I guess, I think we should pay more attention to it. All the things that we discussed needs to start somewhere.
Yeah, see, today, I would, say without a doubt, we have a very famous neurosurgeon at Stanford who says after 60 years of operations and opening up people, today all I can say is just people need to be happier. I've had cardiologists say that I open bodies and hearts every day. I can talk about cholesterol, lipoproteins, all of that. People need to be less stressed. So you see, finally everyone works. Like when I was a nutritionist, I thought nutrition is the magic pill. Everyone should eat this, that, superfood. Today it's 10% of the game. 90% of the game is
even for gastroenterology, what are we saying? We're saying don't eat anything for 12 hours, which means rest to the body, rest to the gut. Again, slow down. Basically, slowing down is
slowing down. But when we're emotionally out of control, we're in a hurry because life's taught us to be that. If we're not busy or we don't appear busy, people think we're useless. I need to do. You can do, but slow down.
Slow down.
Slow down. I always say like a candle burns the fastest. When the flame is hotter, right? We're burning out that way. We can still achieve what we want in life, but we can slow down. Do it with elegance. Don't be constantly on the edge, on the run. And that's when I say know yourself, because most people want to be busy and aspirational in life because it's not truly what they want. It's because their friend is doing it, or they were drilled, you need to do this. Hard work is the only way. Of course, hard work is good, but hard work doesn't mean you punish yourself, you neglect your health.
Exactly.
The harder you're working, the more you need to take care of yourself. So when CEOs and all come to us like, Luke, I'm promoted, I have this. I say, now you have a position which pays you a lot of money, but how are you making your body and your mind bulletproof? Because with responsibility, comes better. You need better health to handle all of this emotional stress and your travel and all of that. So you constantly need to build. It doesn't mean the higher you go, I have an office job and sitting in a cabin. In fact, that's going to make you sick. So it comes down to emotional health at the end of the day.
So out of everything what we discussed, if we have to say one thing to the audience to start somewhere regarding emotional health, what a gratitude journal, manifestation, forgiveness, what will you say?
I would think like right now my message to the audience is, see, everyone has a perfect truth and a lie. I'll start with die. Be real with yourself. Sit today alone, okay, and find out everything that's not going well, whether it's your relationship, your health. Okay, ask yourself, what is the perfect truth? Means, okay, that I need to accept that, hey, Luke, I am lazy. I am eating too much junk. First, get the truths in place before saying a diet doesn't work. I need this, I need that. And find out what is the perfect lie that you tell yourself. I don't have time. No, you have time, but you're spending it wrongly. Okay? I can't go to the gym. Yeah, but I can work out at home. See, everyone is telling themselves a perfect truth and a lie. So the first step is be honest with yourself first. Okay, and now maybe you don't know how to do it. Now take help. I need a coach. I need a therapist. But you should know your truth, otherwise someone else is going to decide it for you. Your therapist is going to see, oh, you're like this because you had a childhood issue. Now, maybe you had a childhood issue, but maybe that's not the root cause of your problem. The root cause of your problem is I'm lazy. I'm on social media too long. Now I'm fixing. The root cause is determined and diagnosed wrong. And I'm going to be in years and years of therapy. Or you come and say, give me a diet, give me a diet. And you got a diet. But you're cheating every day. You're not following it. That's your perfect truth. Your perfect lie is what you're not doing. So now, is it really the diet that you need? Or is it the actions you need to take? Now you can come and say, Luke, I'm a lazy. We have patients who come, look, I know it all. I'm lazy. I just need to be coached. I need to be inspired. Now we know where to start. Your results are going to come sooner rather than going around. So I would ask everyone to be honest with themselves and move out of victim mode. That's the biggest breakdown of emotional health. People are in, this happened to me, so I'm like this. So if you're like this, let's say I'm angry because of my parents or because of my failed relationship. My question is, you have a right to be angry. You're in victim mode now. But is this anger going to solve your problems? If the answer is yes, please go on being angry. But we know the answer is going to be no. So move out of victim mode. Stop blaming everyone. Stop complaining about it. You don't like the country you live in? Go out of live somewhere else. But complaining all the time, is it solving your problem? No. So stop it. It's affecting your health and it's affecting everyone around you. That's the first step towards emotion. Second, if you think you're really emotionally low at this point, get off social media for a week. I can guarantee you're going to feel better. I'm not here to say dump your meds and stuff. I'm not saying that, but I can promise you are going to feel better. So these are the first two things that, and at the end of the day, if I wrap it up, our physical health is a reflection of our emotional health. Our relationships are a reflection of our emotional health.
Absolutely.
Our jobs, our businesses, and everything. So start spending a little more time with your emotions and stuff like that, and your true self. I mean, you're going through a breakup, you don't know whether you should marry this person or not. Vent it out with your friends, talk. But you're just going to get 10 opinions from 10 of your girlfriends or boyfriends, which are based on their life experience. What about asking your authentic self? Listen to their opinions, but say, what do I really want? Is this the person for me? Use your gut instinct. Use your sixth sense. And then make the decision. Don't do it. 10 friends told me to do this, so I'm going to go ahead and do it. I think we have to break away from the box that we've been put in and start looking at the amazing energies. Connect with the divine energies that exist around us. When you're connected with that, you're guided. When you're not, you're led. You're led like sheep. Herd mentality.
Wow.
That's what it is.
It's what a perfect way to end the conversation by talking about gut.
That was not planned though, but it came out. Yeah. Gut instinct.
Gut instinct. It was such a pleasure. Such a pleasure having you in the show. And as I said, it's all for me. I got a lot of advantages. Like I'm talking to you in person. I'm sure my audience learned a lot as well. Thank you so much.
Thank you. Thank you so much, Shah.
Thank you.
Thank you for having me.
Thank you. Bye-bye.
Yeah.